We are live on TV, we are live on radio, and we are live online. But so fa wadwen cheni na no efa Facebook ne so ebra yabeje na yakenkan ede amount na anopei yene wo atoa enkomodie no eso. Ma me kwa homa ne so na mene Dr. Thomas Anaba any enkomo ono executive director at the African Center for Health Policies na anopei meneno any enkomo a research analyst as well. Doc, what's been kind of here? Good morning and Pom to say.
Good morning to you. Good morning to your cherished viewers and listeners.
It's been a very long time though.
Yes, sure. Yes. It's a long time.
Very well. So I'm grateful this morning for having you. Now, the first question has to do with the current state of our health facilities. In some time past, we've seen His Royal Majesty Otumfuo Osei advocate for support in rehabilitating the Komfanoche Teaching Hospital. But at the back of the current brouhaha that has to do with the death of the Deputy Finance Minister, transporting him all the way from Kumasi to the Greater Accra region to seek medical attention is what has called for this particular conversation. And so I put the question to you, I mean, along that particular stretch of road, how many health facilities do we think we have that are in good shape that were supposed to at least have saved the life of our young man?
Thank you very much for having me, Mr. Speaker. And let me start by expressing my sincere condolences to the bereaved family and then all relatives, and pray that the Lord Almighty accept the soul of the departed Deputy Finance Minister in his bosom, and then he will find peace with his Maker. Yes, unfortunate. From Kumasi, one of the second biggest cities in Ghana, to Accra, we don't really have any hospital that we can really say that when you go in there, you can have the right or an international universal standard hospital to save lives, even including Kumasi. And I think that Komfanoche Teaching Hospital is there. You come to Konongo, you have a hospital there. You move down and get into Suhum area, there are hospitals there. You have districts there that need hospitals. You come to Suhum itself, there's a hospital there. From there you come to Sawam, there's a hospital there. But all these hospitals, if you go and look at their equipment, the human resource, what they can do with emergency cases, you see that they lack a lot to be able to handle such issues, simply because of poor investment, lip service that we are paying to our health sector. Ghana could have been a hub in West Africa by now for health tourism if our government had invested and continued with all the investment that was done by its predecessors. But for 7 good years, investment in health has stagnated until COVID came to enlighten the government, and they woke up, but they went back to sleep. I don't know whether they took a diazepam again, and all the projects they promised came to a halt until recently again, campaign is coming. They started pushing for other development, to invest in the health sector. But in 7 years, let's take Legon Hospital. Legon Hospital is a quaternary hospital, should have been the first of its kind in West Africa. Second phase was supposed to be done to complete it, whereby any disease that you can think of, you could have managed it there in Ghana. And people would have come abroad to manage it. But this government came, you remember, and locked it up without opening it until our deposed health minister decided to go there to rest as he told us, that he went there to rest and found it that it was necessary for him to open that hospital. Meanwhile, he hasn't continued the second phase. If we had continued with Legon Hospital, second phase, we wouldn't have had these challenges to be flying people abroad. Leave Legon Hospital. Let's move to Rich Hospital. Rich Hospital was built with a second phase to bring in top-notch specialists to manage the second phase to prevent us from carrying our dignitaries abroad for treatment. This government came in, halted the second phase to add salt to injury. They rather found money to go and build exactly opposite Rich Hospital, the Bank of Ghana headquarters. And just 200 meters from it, we are building the cathedral. Meanwhile, Rich Hospital, that needs a second phase to save lives, is standing there. Not even all what we wanted to do in Rich Hospital is done, because the cardio center that was supposed to be part of it has not even been started. So the government is paying lip service to the system. Let me mention Apari Hospital, which is close to Kumah, Apari Military Hospital. It was abandoned, almost 80% above completed. It was left with only fittings. And even the government came, looked at the fittings and all what they were supposed to use to complete it, to decay. I salute Atufo for coming up boldly to push for the renovation of Komfanoji Teaching Hospital to make it a befitting hospital in Kumasi. But I also blame our traditional leaders for not putting too much pressure in government to make sure health and education is fairly given the needed resources. How much gold do we export from Ashanti? How much money do we need to set up well-renowned, attractive health facilities in Ashanti to take care of people in Ashanti? We've been mining gold for how many years? Let's flash our mind to Dubai. What are they doing with their oil? Go and see the health facilities there. They attract the top-notch specialists in the world to Dubai for us to run there and go and seek help. Why can't we do that with our gold, our mineral resources in Ghana? That is where I think that we have problems. Our government, especially this government, has neglected the health sector so badly that if you check their own promises, 2016 manifesto, they promised to establish in 2016 manifesto, it is policy number Q under health. They said they wanted to establish a cancer center and put it under national health insurance for anybody with cancer to have free treatment. This minister died of cancer, but he was seeking help where? In Germany. In Germany, 2020 manifesto, again, they repeated it. Policy number 135. Policy number 135 in their manifesto. Repeated the same sentence. Establish center for cancer and cover the cost under national health insurance. In 2 consecutive manifestos, MPP has repeated this. But where did our minister go for his health needs when he had cancer? Germany. The only center, private center in Ghana that has been established to treat cancer patients, which is the Swiss Ghana Medical Center. Government hasn't seen it prudent to facilitate them to grow. Government hasn't seen it prudent to give them tax incentives like they've done for hotels as one district, one factory, tax relief, so that they can expand and treat people with cancer. No, government hasn't seen it prudent. But the health, that minister who passed away went there for some of his preliminary examinations. But they didn't see it prudent enough to help that hospital to expand. Even to say, look, whatever equipment you are bringing, buy it, we'll make it tax-free at the port for you. It could have saved Ghana a lot. but we haven't done it. They promised to establish all these cancer centers in Ghana. They haven't done it. Kumasi has a cancer center in Kolebu, in Komfanoche. Go and see how they need resources to run it properly. No one is paying attention.
Yes, so Doc, with all the assertions you've given us, I mean, the indications are quite clear that this is a very serious problem that did not start today or start under the regime of President Akufo-Addo. For governments that have come and gone, I mean, this problem has persisted. And so the question is that as a country, what have been the pragmatic measures we've been able to put in place to resolve some of these challenges we talk about? Because I am looking at the value chain and looking at the stretch of road from Kumasi to Accra. Do we have a very well-befitting health facility that in situations of emergency, I mean, it will be able to sustain the lives of Ghanaians? I mean, presumably, with all the narrations we've received so far about the demise of the former deputy minister, it tells me clearly that all those facilities we have along that stretch of road were unable to sustain him. And so we want to have brought him to Accra.
Sure. It is because, as I said from the beginning, government is paying lip service. And I want to be emphatically clear with you that we saw a good attempt by the previous government in setting up facilities that would resolve this issue of having serious challenges in transferring patients abroad, sending patients abroad to be treated, in minimizing the stress people go to find help in this country. I'll give you an example. Family Teaching Hospital was expanded to take care of the northern sector. One regional hospital was expanded to take care of the northern sector. Bolga Regional Hospital was equally expanded under NDC. But what did this current government do? I tell you, Lucy, let's not blame all government, because Kumah came and expanded Kumah Teaching Hospital. Other governments have come to do it. But this particular government has paid too much lip service to the health sector, played too much politics with the health sector. What have they done to improve on emergency management in Ghana? Except for the ambulances, they've done it and brought it and distributed it to constituencies, which is creating problems in the management. It's creating problems.
How is the ambulance creating problems?
Because the distributed to constituencies, it is under the DCE. Most of the time, unless a DCE gives orders sometimes, the ambulances don't move. We know of it. It's supposed to be under the service, the National Ambulance Service. Then they can work.
Yes, but to the best of my knowledge, they are the ones managing all the ambulances. In all the constituencies. So, I mean, how does a DCE influence the movement of an ambulance, knowing very well that there is an emergency situation to take care of?
Mr. Speaker.
Yes, Dr. Anaba.
Listen to the public. You want an ambulance, and they'll tell you the ambulance is this, is that. Call this person before you get an ambulance. I'm not the one saying it. Go to the public and interview. Go to hospitals and interview how they get ambulance to come. And even now, it is now clear that even upon all that, you have to buy fuel for the ambulance.
That is a serious allegation. I mean, to the best of my knowledge, I don't know of that.
Go to the web and read. The National Ambulance Service CEO defended a staff that patients must buy fuel before it moves because they don't have fuel.
And where did this happen? Where did this happen?
I will send the publication to you. It's not me saying it. You can call the CEO of the National Ambulance Service and ask him whether patients sometimes buy fuel for ambulances or not, where they don't have fuel. So it's not me. So as I was talking, let's go back to the important issue. How many Ghanaians, we are seeing things happen and we are not talking. How many dignitaries in Ghana have flown out of Ghana because they don't trust our health sector? and I'm a doctor, and I feel sometimes very sad that a situation that we can manage, but because we are under-resourced, we have to allow our dignitaries to take the little money we have, fly abroad, and go for treatment. This clearly tells you that they themselves know that they are not treating the health sector very well.
Yes, but it brings to mind that the modalities that the government will have to, probably consider before citing a hospital in a particular location. So on a major highway like that, where you have so many towns and enclaves on that stretch of road, what sort of facilities are we supposed to have? In cases of emergency where you have accident being recorded along that same stretch of road, how do we take care of the people? Now, you have made mention earlier on that with the sort of facilities we have, for instance, in the Suhum Government Hospital, is something that we cannot really write home about. So, what really are we supposed to consider at any point in time where we decide to build a hospital in a particular community or locality?
See, you look at the density, the population, and you look at the trend of diseases there. I always find it difficult when we only talk of highways. Yes, highways pass through towns. So definitely, if it's passing through towns, those towns are populated. You have to categorize the town and see what type of hospital you should put there. And all major towns should have a certain class of hospitals to take care of the needs and passengers who are passing through that corridor. That is what we should consider. So if you see a town that is very small and close to another big town, you don't go and put a complex hospital in a small town. You rather look for the one that is in between and cite a hospital that at least at the range of at this distance, you must meet this type of hospital to get this type of services. It shouldn't be a hospital. It should be services added to the hospitals that are there. And we have all these towns of hospitals. It's just for you to add some of these services, get the needed human resource, put them there, with the required tools to take care of the patient. So it doesn't matter whether it is on a highway or not in a highway and in the rest. We can have bypasses in towns that the highway doesn't even pass through.
Yes, but I'm asking because isn't it surprising that along that corridor, just as you put it, we were able to go bypass, in Koko, we were able to bypass Konongo, okay?
Yeah.
We were able to bypass Ingrisi, which has equally a government hospital. We bypassed the Chibi Hospital and now finally decided to settle on the Suhum Government Hospital. Does it bring to question, the level of facilities we have in those hospitals?
No, the answer is obvious. I even think that from Ashanti region, he shouldn't have even flown to taken to Accra. He should have just been taken to Komfanoche. If Komfanoche was well equipped, because we have a cancer center there that can manage that type of case, but they lack the needed resources. My own mother was treated in Komfanoche in the cancer center. But you see, every cancer has a modality of treatment. And once we have professors in Komfanoche who are managing cancer patients, it was up to government to equip that hospital to manage the environment in the Ashanti region. That anybody sick within Ashanti region with cancer, with any serious ailment, even cardiovascular disease, to find a cardiovascular surgeon in Komfanoche to take care of him. That is strategic planning. What is the population of Ashanti and the population of Greater Accra? Virtually the same. Why can't we have equivalent services there in Ashanti region? Because we are paying lip service. The man, unfortunately, who passed away, I don't want to talk about him, was a well-to-do man. He could influence. The chairman of that party there is a well-to-do man, per what we see. He could influence for a better hospital, a proper renovation and resourcing of Komfanoche to take care of any ailment that we can think of. I'm not saying we should be able to treat all ailments in the world, but at least something like this Kumah should be able to manage because they have cancer specialists there. They have a very renowned, good cancer team at Kumah. It's only because the equipment that they have in Germany, they don't have it there. How can we get it? How much is the cost? Is it more expensive than the Bank of Ghana hospital they are built? Or more expensive than the cathedral they are building? We have misplaced priorities. We have misplaced priorities. That is the problem. Look at the money we spend in reclaiming, the money we spend in buying drones to chase Galamsey. How much money did we spend in buying drones to chase Galamsey that we never did? Couldn't that money be used for better things? When we know those who are doing Galamsey? You see?
Very well, but yes, Doc, but as sector players, I mean, you guys equally have an influence, I mean, when it comes to policy making in the health sector. So in all this while, I mean, what has been the contributions you have made so far in ensuring that some of these things are resolved?
We advocate. We have no power. We advocate. Policy makers would have to listen. And when they listen, they incorporate it in their policies like they've done in 2016 and 2020. They put it there. When it comes to implementation, they rather see it more important to do other things than implementing their own policies.
Are you saying they do not listen to you, especially as the Ministry of Health?
They listen, but they don't take. It is sure that they listen, but they don't want to take. They advise. Because, look, we have a presidential advisor on health. We have my very senior professor, Edubuaini, what is his name? Professor Edujenfi, in the party, who understands health very well. We have very renowned health practitioners in NPP who can advise them very well. And they listen. We all meet and we talk. And they know the challenges. But they are not implementing their own policy, which is bringing the health sector back. If they are continued with the trajectory Mama had taken, it would have been better. Let me tell you, Legon was built with a component to train health professionals to run Legon Hospital Center as a quaternary hospital. When they came, what did they do? All those who were sent to Israel for the training and the rest, they pushed them aside and opened for applications and appointed people they wanted there and did away with all those who went to do the training in Israel. Was that not a waste? Just for political expediency. Now, when people are sick, they run there.
Very well.
When the health minister was sick, she ran there.
Very well. But, Doc, my last two questions, and then we'll wrap it up on this one. So, has it now become necessary that we find a very befitting hospital along that corridor, especially from Kumasi to Accra, from, let's say, Cape Coast or Takoradi to Accra, from Tamale to Accra? I mean, these are very busy stretch of roads where anything at any point in time can happen, and not just to the politicians, but I mean to citizens as well. Should we now begin to think of how we can get hospital or health facilities that are probably, so to speak, even beyond the capacity of a district hospital to accommodate some of these challenges? And finally, you have managed the Ridge Hospital before in some time past. So with what we see, even with Ridge, I mean, is it up to the full capacity and the standard for which we can boast of as a country?
Thank you very much. I think, yes, we need befitting hospitals in all districts, in all regional capitals. If we are able to do that, most of these things would end. We will reduce the mortalities that we are recording. District hospitals should have a capacity at a point. A referral system should be properly followed, so that when you know that there is trauma of this type of patient, you should quickly know, and the ambulance should quickly know which hospital to head towards, or the air bag that is coming for the patient should know quickly where to take that patient off. Because even in America, they don't build hospitals along all the roads to befit all diseases. No, they don't do that. They put a proper referral system. But this is the case that we have concentrated all our efforts in Accra. So we have to disperse it. And we have to intensify and upgrade all district hospitals to a certain level. That if we say that we must have this orthopedic surgeon in all district hospitals, we must make sure we have one there. If we think that we must have an ENT specialist in all regional hospitals, we must make sure we have them there. Not that they should be at in one town alone taking care of that place. So I think it is right we devolve hospitals for the society, not only for politicians, for the society, because we are the ones paying the taxes. And the politicians should make sure they use the money very well. Coming to Rich Hospital. Rich Hospital is not functioning at its fullest. But let me acknowledge what is happening there. They've been able to set up one of the best neurosurgical centers in that hospital, manned by Professor Kaba, and which is something that we should give thumbs up for Rich Hospital. But the second phase that is supposed to come to have the various sub-specialized clinics is what is lacking. That is what we need to put in place. And the same thing we need to do at the Legon Hospital and replicate them in Kumasi, Tamale, Sunyani, Bolga, to make sure that when you are sick, you don't only need to be thinking of Accra. Because I tell you, I studied in a country that the best pediatric hospital is not in the capital. It's in another region. You understand? We can make Kumasi the cancer center for Ghana. We could make Sunyani the orthopedic center for Ghana. So that people go there to train and go back. So that way you distribute it very well and the people benefit from it. We don't need to concentrate everything in Accra. That is defeating. And you have to transport people all the time. Proper referral system, improving the health, human resource development, and giving out the resources that is needed. Let the Agenda 111 finish. But thanks to the Ghana Investment Infrastructure Fund, Agenda 111 should be completed. And I want to ask the government to ensure that they complete the Agenda 111. Let's make sure we resource them well, and most of these things would end.
Very well. Doc, I must be grateful for your time this morning.
Thank you for talking to me.
All right. And to Dr. Thomas Anaba Anameneno Edi Nkombono, or Executive Director at the African Center for Health Policy and Research Analyst as well, speaking to us about the ECOSO within the health sector, bringing us to 19 gone past 8.